Hi and welcome back again. This is the part two of the previous video where I talked with my friend about the Finnish culture, the cultural shock, and most of what we have experienced since we've been in Finland. So if you've not watched that video, please go to the previous one and watch. And now we're going to continue from where we stopped. So we were talking about the like our studies and our interaction with our teachers or the lecturers. So, let me ask you: can you be specific about your how did you really interact? Let me start from there with your teacher. Were you like in any way scared of your lecturers? And do you notice that they were like bossy kind of like African kind of lecturers?
No, no, not at all. It's especially with my tutor teacher. She was like a mother to us.
Yeah,
It was more of a parental love than more like the teacherly love, if I
yeah,
could use that.
that's true.
Yeah, she was so nice to us, and she was very open. It was like anyone can come to her, and it's not that okay. Hey, this madam is like this. Like in Ghana, that's how we were. It was like this madam, dear. We don't like go to her to ask about these things. We don't, yeah, but she was like open to everything. She listened to us when
Mm,
we had, I remember we had
mm.
a problem, like our school brought this, not policy, but this new like rule or something.
Okay,
And then I think our class was having a problem with it
okay.
and we wanted to complain, but it was like we had to pass through her before we go. And although she's like part of the school,
Mm,
ideally she was supposed to be on the school side, but she was like, yeah, I understand you, I will try my best. And she really did try her best to do something about it. But if I look back home, no offense, but like, yeah, it's not really like that, because sometimes, it's they are not all our teachers back home were that open to listen to us and then
yeah.
say, okay, I'll take this your request forward to maybe
Mm.
management or something like that. Yeah, so for me, the lecturers at my school, perfect. Yeah.
Okay, so let's talk about your nursing. Um, what is practice? Because when you talk about practice, some people might not really understand what practice is. So let's talk about your practice. But what is practice first?
Okay. I don't know in Nigeria how
Mm.
they say it, but in Ghana they
Yeah.
say like clinicals.
Okay.
Okay,
Mm.
so
I think it should be the same in Nigeria,
yeah,
or
so
in some department they call it like IT, like industrial training. But in nursing or maybe in medical terms, it's like clinicals.
yeah,
Mm.
clinical. So
Mm.
yeah, that's like
Mm.
here they say more of clinical practice or just
Mm.
practice,
Yeah.
but it's the same thing as like clinicals. So basically, that is you going to the field
Mm.
to practice what you have learned in
In the class.
yeah, in the class.
Yeah.
What you've learned, you are going to practice it in the field.
Okay.
That's all. That's the clinical practice.
So how was your experience? Because a lot of people, some people, let me say not a lot, some people still think that Finland is an English speaking country. As someone asked me that, is Finland not an English speaking country? I was like, no, Finland don't. Although the teaching is in English, most of the schools, the universities and universities for applied science, most of them are in English. But the Finland itself have two languages, right? So can you explain to us the two languages the Finland or the Finnish people speak, and how was your experience during your practice because of the language?
Okay, let me start with the practice.
Mm.
I had For me, before I went for clinical practices, I heard so much about like the practices that, oh, it's like this, it's like that. And what I heard a lot about was the language.
Yeah,
The language. That was like
bedrock.
yeah, that was everyone's like main point. Okay, the language, the language, the language. And truly it was the language. Aside from that, I think the practices were so good. You learn so much. Uh I didn't really do a complete 4-year degree in Ghana,
Okay.
but I did like 1 year. Oh, let me say one semester actually.
Okay.
Yeah, because of Corona. So uh,
Nice.
I went for one clinical practice.
Okay.
Yes. So
As a nurse in Ghana?
yeah,
Yeah,
yeah.
interesting.
So there it was, if you go to like a ward or a department, if we are about, let's say, 5 to 10 student nurses,
Mm.
we are all having like, we don't have a supervisor. It's just like, yeah, you are there, just hang around. Okay. This maybe if you, Gloria, are there, let's say the nurse in charge
Mm.
there. So maybe, okay, they'll just maybe call the 10 of us to the office or something, and then talk to like teachers or something, and then you do stuff, obviously. But then this is my experience.
Yeah.
It's not like what every nurse in Ghana has experienced,
Yeah.
but yeah. But here in Finland, one student to like at least two
Two. Yeah.
or one, yeah,
Or
you
even
can have,
more.
yeah, you can have, yeah, three or
Mm.
yeah, it's you and a supervisor.
Mm.
And I think it's so good. It's such a good system
Yeah,
because
that's
you
true.
really learn, and that person is like in charge of your practice from the first day to the
Mm.
last day, and
Mm.
that helps you to like to know whether you have learned something from
Or
the
not.
practice, because your supervisor knows your progress,
Yeah,
that if
that's true.
on day one you could not cannulate, maybe after 4 or 5 weeks now you can cannulate,
Mm.
something like that.
Yeah.
So I think it's a really good thing. So the clinical practices, I really enjoyed it. I learned so much. The part that was difficult was the the language, which every, let me say, international
Student.
student
Mm.
can testify. Yeah, because the practice, your supervisor may speak English with you,
Mm.
but the patients are not going to speak English with you.
That's true.
They are going to speak either Swedish or Finnish. Where we live in Finland, they speak both languages.
Yeah.
Some parts of Finland speak Finnish.
Yeah.
So
Mm.
in those parts of Finland, they speak more of like the Finnish language. But
Mm.
then in our side, they speak both. So you have to like juggle with the two. That was the difficulty. And it wasn't easy. But then I guess we made it. We
Okay.
made it.
This city you're staying in is more of the Swedish parts,
Yeah.
right? So how were you able to learn in less than 4 years? Both languages, because obviously you speak both languages. So how are you able to learn so fast?
To be honest, what I was told when I like started my practice
Mm.
was like, um more of just listen and use it, and don't be afraid of mistakes.
Yeah.
That was what I was told. My first supervisor, that's what she told me. My sister, who is already like a registered nurse, before I went for my first practice, that's what she also like told me about the language.
Mm.
And so for me, I had the advantage of working in the nursing field whilst I was in school.
Yeah.
And in that area, you use the language at work. We don't use
English
English
at work.
at work. Yeah. You use the language. So the more you use it, the more competent you become at the language. And then the more, of course, you document and those things. So the writing tool comes in. And then whatever backing you to is the school, because our school too, we learned Finnish. And then I think some people did Swedish like as an optional course.
Mm.
So whilst you are, in fact, before you go for your first practice, you have done, I think, like at least one Finnish course, the beginning
Hey.
course in Finnish or something like that.
Mm.
So before you go for your first practice, you know at least one mentor.
What does home mentor means, please?
One mentor is like good morning.
Okay. I remember in one of my practices, a doctor told me yes, I don't know, he was observing me. One day he just called me and said, "Come, sit down." So I now sat down. He was like, if you want to be very good with this language, then I've been seeing that you are making efforts and you're very friendly with your patients. And I like the way you interact. And I was like, okay, thank you. And I said, if you want to be very good with this language, because I see that you're still struggling with the language, I was like, yes. He said, okay, you know what? Kick everyone in your life, anyone that speak English, kick them out of your life. And guess what? I don't. Okay, have I kicked them out?
Please, we are still here.
So, if you're interested in learning the language, for those that want to come to Finland and for those that want to learn the Finnish language or the Swedish or both languages, I think English is a big problem for English speakers. We have more difficulty in learning the language because we easily speak English. But if for those that don't know how to speak English, they easily learn
The language.
either Finnish or Switch very
Very
well,
fast, yeah.
very fast. But those of us that know how to speak English, we take like forever to learn, especially the Finnish language. So if you want to be good with the language, then kick everyone in your life that speak English
Out.
out. Seriously speaking. So that's what I was
At
told,
this
and
junction, we're already
maybe
kicking you out.
we have to kick each other out. Like for real, we have to do that. So, what area of practice was your best?
Wow.
Yeah.
I've been asked this question before and I had to sit down for like 10 minutes. Wow. In terms
and
of
why?
in terms of what? In terms of the learning experience or the experience with my supervisors.
Both experience with the supervisor and also the learning, and yeah, overall. Okay, like mine, I can never forget. I remember I went to diabetic polyclinic for about 2 weeks. I had like 5 weeks practice. I had to divide it into two, 3 weeks in a different place and 2 weeks in diabetic polyclinic. My goodness, I love the way I was treated. Okay, I think I love to be pampered. So they pampered me there. And then the pampering was, they taught me all I needed to learn. They had my time. Every one of all the nurses there had my time. They they are willing to, keep telling me, keep repeating the same thing over and over to me. So I really loved. At the end of my study year, I decided, okay, I'm going to be a diabetic nurse just because of the way I was treated, just for 2 weeks. And then I went to the current place I'm working currently, happened to be my worst practice place. For some reason, it's an acute ward, and everyone is acute in that. We, including myself, I think I'm very acute. So I love. Okay, I learned a lot because in acute ward you keep learning every day is like
Yeah.
new. You learn everything new every day. So at the end of my practice, I discovered that I felt that I've not learned anything. So I was asked, "Ah, do you like to work here?" I was like, "Yes," because I want to relearn what I've learned, and learn and keep learning. So I stay there to learn. You understand? So, what was your best place?
Based on what you said,
Yeah.
I would say my first practice was
Okay.
my best practice, but my favorite practice was my third practice. That was my internal medicine practice, like medical nursing
Okay.
practice. That was also an acute ward,
Mm.
but it was more like heart patient and lung patient. I loved it because of my supervisor. She was amazing. And like because of the way she treated me during the practice, I considered that my favorite practice. Of course, I learned much, but the reason why I say my first practice is like the best, it was because I didn't know what I was going into for my first practice.
Yeah, normally
I
like that.
didn't know how it would be like. I had heard so much about like other people's practices. I remember our mates, like my mates, they had like like one practice before me. So by the time
Okay.
I was going for practice, some of my classmates had already gone for like their one practice. Yeah. So for me, it was like, okay, I was just thinking and thinking and thinking. But when I went, my supervisors made sure I understood, and then let me say, I got into it. I got interested in nursing. Yeah.
Hmm.
They made me like
Hmm.
get this confidence that
Hmm.
okay, I can do
Do
it.
it.
Yeah. So that's like my best practice because they taught me the basics of everything. Yeah. And that was
Okay.
what gave me the interest. And that's where I worked for some time when I graduated. Yeah.
Wow. Okay. Interesting. Um, I would like to ask you, how much are you being paid as a registered nurse? Because those that want to study register, those that want to be a registered nurse or want to come and study Bachelor of Healthcare Nursing, they want to know if is it worth it, to come down here to study nursing. So how much are nurses being paid?
Roughly, wow,
Yeah, roughly.
roughly. Let me
Mm,
use the hourly pay.
yeah.
Per hour. Okay. For those working, like if you work 100%, that is 5 days per week.
Mm,
Yeah, about 17 or 18 euros per hour.
okay.
Yeah. Yeah. Depends. I don't know because where I'm working my place where I work is a specialized ward.
Mm,
So the pay is different from like in a maybe general medicine ward or something. But I think it's averagely 17 to 18 euros per
per
hour.
hour.
And then I think as a student nurse,
Mm,
when you work as a student nurse too, the pay is also I think 14 or 15. But the lowest I have seen is 12
12
euros
euro per
per hour.
hour.
Yeah.
All right. Thank you very much.
Thank you too.
Um, can you tell us in a very simple way, like how we can actually learn the language again? Because this is like a bone of contention to most people, the language.
Okay.
Mm,
Two things that I was told.
yeah.
Uh, do not be afraid of making mistakes and just use the language as often as possible. Whether you are sleeping, you are showering, eating, just use the language as much as possible. And don't be afraid of making mistakes. If you feel like, I'm not sure about the grammar, so maybe you will not, just say it because when you say it, you will be corrected. And next time you use the correct sentence. That's the two things I'll use. Yeah. Just don't be afraid of mistakes. Yeah.
So we have come to the end of today's interview. So, guys, for those of us that want to learn this language effectively, please kick out any English speaking person around your life,
Okay, Gloria.
including your husband. All right, with this, I would like to say thank you for staying tuned. And for those that have not subscribed yet, please do where to subscribe to this channel.
Subscribe to this
Yes,
video.
please. And like this video, turn on your notification bell to get notified whenever I post a new video. And with this, I say thank you and see you in the next video. Bye.